want to talk about certain emotional states such as anxiety, manic depression, schizophrenia even, and talk about why people might have these symptoms. I don't call them mental illness because these are not diseases in the brain at all. That has very little to do with it. In fact, these are not medical conditions at all. There's no physical tests for them. There are two causes of illness: deficiency or toxicity. In psychology, we could say the same thing. People can have a psychological problem because either things that should happen don't happen, or things that should not happen happen. So again, whether it's nutrition, whether it's psychology, there's deficiencies or toxicities. Those are the causes of illness. So when you have a symptom, that symptom is either going to be caused by not giving your body something that it needs, or giving your body something it doesn't need. No ifs, ands, or buts. Those are the only causes of illness. There are genetics, but genetic issues will be passed down, toxicity from previous generations and so forth. So let's kind of think about some things, first of all, such as debunking these stupid ideas that the anxiety or generalized anxiety disorder is because neurotransmitters are off in the brain. That is such an incredibly reductionistic notion. First of all, there's no scientific evidence for it whatsoever. There's no study showing people with anxiety have this neurotransmitter profile or whatever. But that's really following this conventional allopathic model where we say, oh, someone has a symptom, so let's suppress the symptom. So the idea is that someone has a cough, let's give them something so their body can't produce a cough. But that's just only going to make someone sick. For an example, let's say a child has tonsillitis. So the medical doctor does surgery and takes out the tonsils. Well, now you just removed the body's part of the body's immune system, so the body can't respond to infection easily, and then years on, that person gets a heart attack and is dead because they had their tonsils taken out. And these things happen. There's association between having your tonsils taken out and cardiovascular disease. So you don't want to take a symptom and suppress it. And that's what psychiatric drugs do when it comes to anxiety, schizophrenia, whatever. I'm not saying that in certain extreme cases things don't have to be done to control symptoms, especially since there's schizophrenia. But if you're taking a medication for mental symptoms, you're not taking it to enhance health. You're taking something which is a specific neurological poison that destroys parts of the nervous system in order to stop your nervous system from producing a specific result. And this is how many pharmaceutical drugs work. They do nothing for health. They just poison the body. For example, if someone has high blood pressure, you can take a blood pressure medication which poisons the kidneys, so the kidneys can no longer regulate fluid balance, and you dump more water, and then blood pressure drops. That's not really working on the cause of high blood pressure. That's just poisoning the body. And in the long run, you're not really going to make someone healthy. So we want to look at anxiety and these sort of schizophrenia even and say, why is the body producing it? Now, there might be a whole host of physical issues causing these symptoms that no one is looking at. And all over the internet you can find people who are taking psych drugs for their mental symptoms, and they're like, I tried everything. And I'm sure 99% of the time you go through their history, you're going to find they really have tried nothing, and 100% of the time they did not try everything. Because the one thing they did not ever try is actually working on the cause of their problems. Going to a professional who knows what they're doing and holistically going through a case and looking at all the causes. So there are physical things that you have to think of. For example, subclinical infection triggering the nervous system, resulting in anxiety. There are many people going around with so-called mental symptoms, whether it's anxiety, panic attack, manic depression, taking psychiatric drugs for it, saying that they did everything, and what they really have is a weak immune system. And in my practice, I've had people with all those things you go through the history, and they have a messed up immune system. And they say, I don't understand. How could this be? I never get sick. Yeah, that's the problem. You're so weakened that your body can't even produce symptoms. So you think you're fine. You think you're not getting sick. In fact, you're sick constantly all the time, and your body can't even produce a sore throat to try to remove some of the toxic assault. And then this is triggering the nervous system, and then you're going around with whatever mental symptom, and you think you have a chemical imbalance in the brain. There are also like things like neurotransmitter tests, which, by the way, there's no fucking test that looks at neurotransmitters in the brain. But I think that if you really look overall at all the other factors, you're going to find that most people don't have these things because they need a neurotransmitter test. The whole idea that people have mental symptoms because their neurotransmitters are off is a nonsense made up in order to sell psychiatric medications, and then this nonsense has kind of been hijacked by certain elements within the world of natural health and functional medicine. So you hear, if you're depressed, take 5-HCP. If you have a panic attack, take GABA. And these things might help someone in certain circumstances, and in a minority of circumstances, this is really what the person needs because there is a big deficiency issue. But this is not holistically looking at what the problem is, or it's not really looking at what people need to do. And what you have to do is say, oh, you have a panic attack. You have symptoms of schizophrenia. You're hearing voices in your head. Why is your body producing these symptoms? Body produces symptoms because of deficiency or toxicity. I want to talk about toxicity. What type of toxins are coming into someone which is causing them to produce these symptoms? There can be issues of physical toxins for sure. So if you go through a case, go through a comprehensive history, that's one of the things you want to think about. What type of toxins? Viral toxin? Mercury, is that a toxin? So forth. But let's talk about organ system function and emotional toxins. First of all, emotions are not neurotransmitters in the head. We feel emotions with our entire body. So if someone is sad, they had a loss, someone died, you can start seeing someone's going to cry. What's crying? That's an emotional release. That's a detoxification response. The body is coping with the emotion of grief by physically moving it out through the lungs, through the eyes. So we want to understand that if there's grief, crying is a healthy response that the body is doing in order to take this emotional state, this vibrational state, and discharge it. Because what does the body do when a toxin comes in? The body has to look at the toxin, recognize it, understand the figure of what this toxin is, and then let it go. This is true for physical toxins. It's true for emotional toxins. What happens if the body can't let something go? It's going to take that toxin and it's going to store it somewhere. So if you have someone, for example, eating lots of margarine, which is a really bad fat-soluble toxin, might take that and they're eating it, then next thing you know, they might end up getting like lipomas, the deposits of fat under the skin, just a store of fat there. Why would the body create this fatty lump under skin for no reason? Well, it's doing it for a reason, such as it has some fat-soluble toxin, doesn't know how to discharge it, so it's storing it. If there is a big emotional stress, so say someone died, and now you have someone who's close to that person, and they're trying to deal with it. Let's say instead of dealing with that experience in a healthy way and talking it out, crying, discharging it, they suppress all of that. Then they're holding it in. Now, what's the body going to do? It's going to start storing it in. Emotionally speaking, we're storing that in. And someone might not know that they're storing something. And just like there might be a physical toxin and someone has cysts in the liver or cysts in the kidney that they don't know about, but you'll see it on an MRI, there might be an emotional assault and someone suppresses it and they don't even know it's there. And then all of a sudden, schizophrenia. Because I don't have extensive work in schizophrenia, but the schizophrenics who I have seen, they did some job at suppressing emotions. And then there has to be this understanding that because the body was not allowed to discharge that toxic energy through healthy ways, it kind of came in there, and then it's just sitting in the entire body, and then something like schizophrenia is the response. It's the body somehow trying to mobilize this out. It's not being very effective at moving whatever out, but it is a attempt to deal with an underlying problem. So something like schizophrenia absolutely can be an example of the body within its infinite intelligence trying to deal with an underlying problem. Same thing with panic attacks, generalized anxiety. An emotional stress comes in, someone either suppresses moving it out, or they're just hit over and over again with this emotional stress. It overwhelms them, and then you have a panic attack in order to discharge it. This is a new age mumbo jumbo. Like, the simplest example I can give is, let's say you walk out of your room and someone is next to you and they start yelling and screaming at you and all sorts of stuff. And then you come back away, and then you walk away from them, you go into another room. What are you going to do? You're going to shake it off a little. It's going to be like, oh, like discharge. Why? Because you just had this toxic assault of negative energy and your body has to get rid of it. That's panic attack. Panic attack is just take that to another degree. It's your body being overloaded with some type of negative emotional state, some type of negative vibration, and we're panicking in order to try to let go of it. That's what these things are. And it doesn't have to be this. These are complex, multifactorial problems. Yeah, it could be a subclinical infection. It could be, yeah, you had a root canal and then there was an infection under there, and then you took antibiotics afterward, which suppressed the immune system's response, and now you're triggering the immune system. So there can be other reasons why people might have these things. We want to look at the emotional side. We have to get rid of it. Now, you take a case of anxiety, schizophrenia, and if in the history is showing, yes, someone didn't discharge this emotion that they're holding in, you have to help them get rid of it. You have to help them move it out. You don't have to give them chemicals, whether drugs or supplements, to fix the neurotransmitters in their brain. Because what's going on in the brain in terms of neurotransmitters is something that's very deep in our body. Our body is going to sacrifice other organ system functions. It's going to sacrifice a lot before it allows brain biochemistry to really be disturbed. There's a blood-brain barrier. I mean, there are things that can interfere with brain function, but it's not as easy as other systems. So it's not like, oh, you're a little bit low on some B vitamins and tyrosine, so now you have schizophrenia or panic attack. The panic attack or schizophrenia is the logical response. But emotions are not simply in the brain. We feel emotions with our entire body. Maybe someone has a panic attack because there is a functional issue with their kidneys. Their kidneys, let's say they were a child, they had, I keep on going back to the whole tonsil thing. Let's say as a child they had lots of upper respiratory infections, and then their tonsils were surgically removed. So that means that their body now cannot deal with infection so well, and then that's putting a burden on the kidneys. And now it's 20 years later, their body never overcame the infectious problem to begin with. That was just suppressed. They had their tonsils removed. They were told that they're fine, but they weren't fine. And now the kidneys are not able to perform all their functions. Kidneys remove water-soluble toxins. Kidneys will remove fear. Chinese medicine, fear is related to the kidneys. Liver is associated with anger, lungs grief, worry or rumination, stomach spleen, heart is associated with joy. So because there was that issue up in their tonsils, then it suppressed, the issue traveled to their kidneys. Kidneys not moving fear out. Panic attack. What does that person need to do? Support kidney function. You can have someone with anger, liver problem. Or maybe someone has anger or fear because of because something emotionally happened. And at the time that happened, the body could not discharge it, so to hold it in somatically. Somatically held emotions is critically important to understand. What this is saying is that there is a vibration or emotional state that's not a cognitive function. This is not something that you need to go to a psychologist for help, but your organ systems are holding on to it. So there was an issue of some fearful event happened, and your body couldn't fully deal with it at the time. Now it's holding on to that emotional state somatically. You're holding it here. You can talk about it all you want. You can go to all the therapists in the world for this panic attack, but it's not being driven by any psychological problem anymore. It's a vibrational effect in your body. Something like homeopathy would be very good in that case, because that's going to teach the body how to let go of that, or some other energetic therapy. So in understanding anxiety, panic attacks, schizophrenia, bipolar disorder, whatever bullshit label you want to give these things, look at the entire body. Are there any physical problems going on? Is there anything psychologically going on? What organ systems are being affected? We want to look at all the planes that we function on. We function on a physical plane, we function on an emotional plane, we function on a mental plane. In Chinese medicine, the heart houses the Shen, spirit, just organize all of that. Disturbance in any one of those areas can produce a disturbance in another area. And if you take these cases and you look at someone as a holistic being, you're going to see that their mental symptoms is their body's intelligent way of trying to deal with the problem. You treat the condition by not treating anxiety or treating schizophrenia. It is the fucking stupidest thing in the world to say you're going to treat whatever, generalized anxiety disorder. You're going to treat schizophrenia. Schizophrenia is a mental symptom produced by your brain as a response to some type of stress. You give the body what it needs to discharge that stress. And if people did this, then they'll find that they don't need to take the psychiatric medications. The only thing psychiatric drugs do is they poison the nervous system so you can't produce these symptoms. And it's just later on, it's just going to get worse because you're suppressing. Anytime you suppress symptoms, you're driving the disease process deeper into the body. Okay, I hope that makes sense. I hope this wasn't kind of boring for anyone. You know, I have one kind of funny video about anxiety and schizophrenia that has 19,000 views. So I thought I'd try to put something a little bit more serious. This isn't a professional video, so I'm putting it on my personal channel. But that's it. Bye.